Thousands of children are now on summer break, and summer can be a dangerous time when it comes to your child and peer pressure. And here to discuss how to talk to your children about the dangers of drugs is crisis coach Scott Silverman. Scott, good morning.
Good morning.
So let's talk about this from the fact that, of course, it's out there. People hear about it, kids hear about it. They're probably exposed to it younger than what they used to be. So education comes first, I would imagine.
It's real important. I mean, your opening volley there was, it's a dangerous time. Summer shouldn't have to be a dangerous time.
Sure.
So that's the kind of environment that we're in today, and I think it's real important to understand that that is out there right now. It's part of what we have to deal with our culture and our community and our families. So being aware, getting educated, and trying to find ways to tee up your children and give them the tools they need to make informed decisions.
And that's a big part of it. Maybe they have some knowledge, some education, but you kind of have to help them connect the dots and realize the dangers of their decisions.
Most of us, when we were young, I can't remember what that's like, but I know it was there, believe we're invincible. We believe we can do anything. Sometimes we think we can fly. So it's important to not necessarily get them grounded, but to share information, but more importantly, let them talk to you. You know, I like the saying that we have two ears and one mouth, and that works both ways. Even though you may see your child kind of heading in a direction that you're uncomfortable with, well, get informed, get information. And then when you talk with them, rather than giving them what you think they need to do, because kids are smart today, and even if they're not thinking that they're smart, they're gonna go talk to somebody who tells them they are smart and that the parents don't know. So you have to be cautious, I think, of using trigger words that cause them to not want to come back to you to be their advisor. Even though your level of love is greater than anyone else with your children sometimes don't believe that you have their best interest at heart when it comes to the life choices they want to make.
Of course, because if you say don't do it, then they say, well, then I should do it.
My first book was Tell Me No, I Dare You, so you're absolutely right. And telling a kid not to do something is almost like subconsciously giving them permission to think, you know what, I probably am going to now.
And so I think the conversation is the most important part, but it can't be a one-sided conversation. You can't just be talking at them. It needs to be an actual conversation. You say as a parent, your number one thing to do is listen.
You know, I call it the shut up syndrome. Some parents say, what do I do? I said, stop talking. Because if your modality of how you communicate with your child isn't working, let's try to shift it a little bit. Not that you're not the smartest one in the room, and you probably are, but if your guest in the room, if you will, or your partner in the room, or your child is not listening, it doesn't matter what you're saying. So be mindful and ask yourself, when you were young, what did you do? How did you respond when your parents? So try to pivot just a little bit, and when you ask a question, wait for the answer. And when you ask the question, don't pile on with what you think they shouldn't do, because at that point, they've turned you off. And it's really more of a modality of what happens today with communication and with COVID, and I keep coming back to that because we don't know long-term study-wise what that's like with kids who had to spend all that time alone, but they weren't alone. They were on the internet, they were talking to other people, they were finding ways to feel better about not being able to get out and do what they normally do. So we've got to be sensitive. Not that you have to walk on eggshells, but you have to be mindful that you may need to have yourself in a position where when you speak, they're ready to receive. So you time it. And sometimes sitting at dinner is the best time. Everybody puts their phone in a basket, move the basket, and we talk, just like you told me to move my phone this morning.
Yes, exactly. Now, speaking of your phone, give your cell phone number so that people can contact you.
It's 619-993-2738. Hasn't changed, and I really invite people to make a phone call. You and I were talking earlier about how do we really help people. Be a resource. And be a resource as a family member, because 10 years ago,
sure,
when you were just getting out of high school, 1 in 10 people knew somebody who had an issue. Today, it's 10 out of 10. Everybody either directly in their family or they know someone in their family who knows someone who's going through an issue. And we haven't even talked about the mental health issues that are part of what's going on in the world today. And unfortunately, our public sector leadership is not really spending time with that aspect of what we need to do, and the stigma is still there. So ask for help, make a phone call. If you don't call me, call somebody. And if you call me, if I can't help you, I will help you get pointed in the right direction.
All right. All right. Thanks, Scott. Great to see you.